Hi, my name is Dr. Anthony Yee. I'm an orthopedic surgeon here at Orthopedic Specialists of Seattle. I specialize in orthopedic foot and ankle surgery. After my residency right down the road here at the University of Washington, I decided to pursue a fellowship specifically in foot and ankle surgery at Harvard Brigham and Women's, where I got to learn from some of the really great mentors in the field. So I specialize in taking care of foot and ankle patients, both non-surgically and surgically. I love orthopedic surgery. I honestly think it's the best job in the world. I think there were a lot of different factors that motivated me to become an orthopedic surgeon. First, on a personal level, I had a pretty bad ankle injury myself in high school, playing football, and ultimately underwent surgery for it. And that experience, undergoing surgery and the rehab process, really opened my eyes to this profession where you quite literally get to help people back onto their feet and get back doing what they love to do. And I love that about my job. Second, I think on an intellectual level, I think that orthopedic surgery is very, very intellectually stimulating, particularly, in my opinion, the foot and ankle. I think the foot and ankle is very complex and fascinating. And one thing that I really love about it is that there are a lot of questions that remain unanswered. I love the challenge of figuring out a patient's problem and coming up with solutions for it, whether that involves surgery or not. And finally, on a physical level, I love working with my hands. I think it's the coolest thing in the world to walk into an operating room with the patient having a problem, and then a couple hours later, walking out having provided them with a solution through surgery. I went to undergrad and med school down at the University of Southern California in Los Angeles. And then afterwards, I came back here to Seattle for my general orthopedic surgery training, which was 5 years long, where I had the awesome opportunity to train under some great mentors in all the different subspecialties of orthopedics. And after that, I pursued an extra fellowship specifically in foot and ankle surgery at Harvard Brigham and Women's, where I had a great time, learning so much from mentors who I still consider friends and still reach out to for advice, where I learned a lot of really cool newer surgical techniques as well. I love orthopedic surgery. During orthopedic surgery residency, it really opened my eyes also to the subspecialty of orthopedic foot and ankle surgery. And I ultimately decided to become a foot and ankle specialist because of the diversity that it allows me to experience, whether it's different kinds of patients, different kinds of issues involving the foot and ankle. And I feel like out of all the subspecialties within orthopedics, foot and ankle has a little bit of each of them. For example, I get to help patients who have traumatic injuries like broken bones. I can fix them. I help patients with athletic injuries like ankle instability or Achilles tendon ruptures. I get to help patients with arthritis, whether that involve ankle replacement. I also get to have the opportunity to help patients who have big foot deformities and correct them through complex reconstructions. So I really do enjoy the complex, diverse nature of orthopedic foot and ankle surgery. I think one of the best parts of my job is how gratifying it is to see patients do well after surgery, whether it's an injury that they had and I'm fixing a broken bone, or whether it's an issue that's been really nagging them for many years and I'm helping them in terms of increasing their function and eliminating their pain through a procedure. There's no better feeling in the world, truly, than helping a patient and seeing them months down the line and seeing them very happy and getting back their life, doing the things they want to do and love doing.